Frankly, at every opportunity, they have said, let's let the states make the decisions. A lot of that has to do with people like Teresa Miller, Joel Arrio, Steve Larson, even Secretary Sebelius, Sally McCarty. All the key decision makers actually used to be commissioners. So they definitely have that bent to it. So that kind of leaves it up to the states, doesn't it? So that's what I'm going to talk about. What are states doing? What should you be doing? What do you need to do to get prepared for all of this? Because a lot of decisions can be made by the state, and I think states would all agree that that's where the decision should be made. Of course, we do have this little thing called a lawsuit. I don't know if anybody heard about it. Supreme Court's going to be making some decisions pretty soon, and a lot of states are kind of saying, well, why don't we just wait? Why don't we just wait for that decision? We don't want to waste any time, any effort. Well, I liken it to this, and I'll use an example I think everybody else here can understand. LSU football.
That's a bad example.
LSU, 2 minutes to go in the game, down by 1. Stay with me. They are in field goal range. Like I said, under 2 minutes, first down. What is the one thing they should not do? Everybody together now. 1, 2, 3. Pass. Very good. Why don't you pass? Every analyst will tell you the only thing, there's 4 things that can happen when you pass, and 3 of them are bad and can lose you the game, right? Everybody agree? You can make the reception, dandy, you gain the yards, drive it down, excellent. What are the other 3? You can get sacked, be moved out of field goal range, you can get it intercepted, or you can drop the ball, and what happens? Clock stops, may give the other team some more time. These are 3 bad things. I would look at the Supreme Court decision in the same way. There are 4 things that can happen. 3 of them are bad if you've done nothing but pass on this issue. Yes, they could strike the whole thing down. Then you can just stick your tongue at everybody else and say, ha ha, we didn't waste our time. We knew it all along. You could take that approach. Or they could kind of just say, well, it's not ripe yet. That's one of the decisions they have to make. It's not ripe yet. We won't make a decision now. We'll wait until 2014. In that case, everything's passing you by. Federal government's going to come in. They're going to set up. And as much as we love them, how many want the federal government making all the decisions in your state? Nothing personal. We go way back. She would have said the same thing a few months ago. The other one is they could just strike down the individual mandate. Just take that one little provision. It's unconstitutional, they may say. Strike that down. But what does that leave? That leaves everything else, doesn't it? Everything else will keep rolling along, including exchanges and the market reforms and everything else. They could also, on the same decision, say, well, we'll strike it and a few other provisions like guarantee issue or the rating reforms. What else still goes, though, folks? The exchanges and the essential benefits and all those kinds of things. And the 4th thing that could happen is they could say it's all constitutional and let's roll. So as the states sit there and try to make up their decisions of what they're going to do, I would say the one thing you cannot do is just completely pass and say, we're not going to do anything, we're not going to prepare, we're not going to look at it, and sit there and let the federal government take over. And here's why. In the law, it is very state-centered. In the regulations, they have said, even if it is a federally facilitated exchange, which it will be in Louisiana, I assume, at this point. It'll be federally facilitated. Even if it's federally facilitated, still the state can make some major decisions and play a major role in the regulation of the marketplace. But you have to start preparing now, or else they'll take it over. Let me give you a few examples. One is on essential health benefits. The secretary, under the law, is supposed to determine what the essential health benefits is. She has basically said, I would be happy to punt that decision to the states. I will give you some options. 3 largest small group, 3 largest federal employee plans nationally, 3 largest state employee plans, the largest HMO. You choose from one of those, and it'll be okay. But if you do not choose, the federal government will choose the largest small group plan. That's the way it works. You say, well, that's fine. I probably would have taken that anyways, but let me warn you. There are in law 10 categories over here that have to be in your essential health benefit package. If that small business plan that is chosen does not include one of those categories, such as pediatric dental, Habilitative services are probably big ones that could not be, or possibly wouldn't be, a small group plan. That means that they have to go out and find another plan, maybe the federal employee plan or some other plan. They have to go and grab it from there and put it in. Who do you think would best be suited to make that kind of decision as to what plan should be chosen? Where to go get that plan and make sure it's something that the people need in the state of Louisiana? People of Louisiana. I would say, let them make that decision. So it's best for the state to make the decision. Go out, find out which 3 plans you think are the largest, see what the benefits are, see which one best fits your needs in the state. And I would note, yes, the small employee plan will include all of your mandated benefits, such as, looking through your list, you have autism, you have rehabilitative services, you have metabolic disorders, you have several that some other states don't have. I would note, though, if any of those benefits, any of your mandated benefits have a dollar annual or lifetime limit, which some have put those on autism and some of the metabolic disorders and things like those kinds of things. I don't know yours well enough. But if they do, if it becomes an essential benefit, you have to get rid of the dollar limit. Now, you can have visit limits, called internal limits. You can have visit limits or service limits, but you cannot have any dollar limits. So you may want to take a look at because if the federal government's choosing the small business plan and includes a mandated benefit that has a dollar limit of any kind on it, the dollar limit goes away. You need to think about these things. That's why the best place to make the decision is where? Let's go on. What about reinsurance? A lot of people aren't focusing too much on this, but there's going to be a national program of reinsurance. In the first year alone, they're going to take $10 billion. Is that a lot of money? Nah. No, they're going to take $10 billion, and what they're going to do is they're going to take that from self-insured plans, large group plans, small group plans, and individual plans. They're going to take it by state. So basically, those plans, as they're enrolled in the state of Louisiana, you will get your portion based on enrollment in Louisiana, and it will then be used to help the individual market plans in Louisiana. Now, here comes the question. Who's going to decide how to distribute that money? Who should decide how to distribute that money? The option is the state. State can say, we will set up the reinsurance program, we will set up the parameters, we will decide who should get that money, and we will run it to the benefit of the people of Louisiana. Or you can let who? Don't look at her. She's not the federal government. She's not the enemy.
Thank you.
Let's try to help you out. No, but and they're going to have to. They can't sit there and tailor it to each state. It's impossible. They're going to have to come up with a basic formula of how to distribute it, and it may not be best. So who should make the decision? And this is whether you have a federally facilitated or a state exchange. It doesn't matter. Either one, you can still choose to do your reinsurance program. But you have to start preparing for that now if you want to do that. Let's take the exchange. Now again, I'm pretty sure you're not going to do a state-based exchange at this time. But even with a federally facilitated exchange, if you look at the regulations, it says we are more than willing as the federal government, if we're running it, to farm out a lot of the responsibility to the states. Where the states have been doing it and frankly will be doing these things for the outside market, we would love to have them do it for the inside market as well, those in the exchange. But the state has to decide to do it. So let's run through a few areas. For example, who should decide who may participate in the exchange? Should it be the state or the federal government? State. As it stands, if it's a federally facilitated exchange and you're letting them do the plan management, they could decide who gets to participate. Now, they're leaning towards basically saying, we haven't seen the details yet, but our conversations, it's kind of a let everybody. But I would note, if they have excessive rate increases, they cannot participate. Whereas if the state is running it, running the plan management or running those kinds of things, you may have some more options. So you can decide who gets to sell through the exchange. Is that an important decision? Yes, it is. Also, rate review. Under the exchange rules, every rate increase, not just those 10% and above, all rate increases must be reviewed. Again, is that going to be the federal government doing it, or is it going to be the state? If you want the state doing it and having final say, which they really do anyways, but if you want to be part of that process, and we've talked about legislation today that would kind of bring Louisiana into this, then you have to make the decision and say, yes, I will do that. And it won't matter whether you're inside or outside the exchange. Every insurance company will submit it through SURF. We will review every one of them, and we'll just let the exchange, the federal exchange, know which ones meet the requirements, which have been reviewed, which ones have been approved, and let it go. Again, state or federal, it's up to the state. Form review, who's going to decide whether the metal levels, the various actuarial levels, value levels, whether they meet those, whether they meet all the essential health benefits, whether they are allowed to substitute one benefit for another under essential health benefits. Again, this review process, you could say, let the federal government do it. Well, they don't want to. And they would have to hire a bunch of people. It's going to be very costly. The insurance companies would have to submit to the state for the outside market, submit to the federal government for the exchange, go through 2 different processes. It's going to be a nightmare. Or the state could say, we'll do it for everybody. This goes for network adequacy. Who's going to decide on the rules for network adequacy? Louisiana has rules. These rules have worked well for the state of Louisiana. Do you want the federal government coming and saying, no, I want to use the same rules I'm using in this other state because I'm going to use one system nationwide? Who's going to decide what the network adequacy rules are? Who's going to decide what the quality standards are and how those are applied? Who's going to decide how agents and brokers participate? Anybody care about that? Who do you want deciding that? You want the federal government to decide how agents and brokers can interact with the exchange, how they can pay, who can pay them, how much? Or do you want the state deciding that? How about navigators? Do you want the federal government deciding who can be a navigator, what the qualifications and what the role and what the rules for navigators are? Or do you want the state deciding that and entering into those contracts? All of these decisions can be made by the state. That's what the federal government has said. In their rule, they said, this plan management functions, we would be happy to let the state do that. They'll have to meet the minimum standards of actually doing these things, making sure they are qualified health plans, but the state can do it. But you have to prepare now. You can't just say, oh, I'm going to wait till the Supreme Court decision, I'm going to wait for the election, and then I'll turn it on, and just, it's not going to work that way. So you got to start thinking about these things now. How would you want to do these things? This also goes for consumer assistance. They've also said states, they'd be happy to let the states do the consumer assistance, just getting that information to the federal exchange so they know what's going on, but actually do the process of that interface with the consumers. Also, Medicaid eligibility. We had your Medicaid secretary here today, Secretary of Health. How many want the federal government deciding who's eligible for Medicaid in your state? Whose money would be on the line? The states and the feds. Or would the state like to be the one determining eligibility? See, that's one of the processes of the exchange is to take applications and determine eligibility for Medicaid. And then, if they're not eligible for that, determine eligibility for subsidies and things like that. If the state's completely out of it and said, I don't care, I'm going to let the feds do it, then they're going to do that part too. Again, they've said, though, we'd be happy to let the states do that. So a lot of decisions need to be made, but I was going to mix my metaphors and go to tennis. I'm not going to do a ball in the court. Whose turn is it? State's turn. They've got to decide on these things. What are you going to do? And you need to kind of step up and say, okay, yes, okay, we're going to do a federally facilitated exchange, and that's a fine decision. But just in case that Supreme Court takes one of those other 3 decisions and not the one, maybe we ought to be prepared and figure out how we want to do this and how we want to do the plan management. I'm not just saying that to Louisiana, we say this to every state. And that's also one of the reasons the NEIC is bringing together people, just a little advertising here. We're bringing together the states, especially those who have already kind of gone down this road, and we're developing some white papers on plan management. Basically saying, okay, state, if you want to do the plan management functions that we just talked about, interfacing with either a state exchange or a federal exchange, here's the things you would need to do. This is how you can accomplish that. Here's some options for you. Just so if states are waiting, they can move quickly and get these things up and running. We do open calls, open comments. Everybody here can participate. Not all at the same time, hopefully, but everybody participate. And I would just one more thing. We focus a lot on exchanges and things, but I also want to note that there's going to be some major market reforms coming in 2014. Don't miss those too. This is probably more for the legislators. They've got to figure out what they're going to do with Louisiana law to make sure it's compliant with the federal law, or else the federal law will preempt state law, and the state will be out of the business of regulating. I don't think anybody wants that. I don't think the commissioner wants that. So in areas such as guarantee issue in the individual market, no pre-existing condition exclusions in the individual small group market, the rating reforms that was talked about earlier, all of those have to be in state law. They have to meet the minimums of the federal law, or else the federal government will come in, preempt your laws, and be the regulator. That's the rules. It's just like HIPAA. Everybody remember HIPAA? Same thing. If the state doesn't do it, now I was working for Governor Wilson at the time. I was with the state of California. We were one of the 2 states that said, no, we're not going to do it. He coined a phrase, we wanted to make T-shirts, federal fatigue. We've just gone through welfare reform. We've just gone through a big Medicaid block grant battle, and frankly, he was just tired of the federal government telling him what to do, so he said, I ain't going to do it. So anybody had a complaint, anybody had a problem, we would send them to the San Francisco HCC office, that's what it was called back then, send them to HCC and say, you got to deal with it. But this is a whole different animal here. This is everything. This is a marketplace. This isn't just small group guarantee issue and stuff. This is the whole marketplace. And if the states don't have these rules in place, what you're saying is, we want the feds to do it. So I'll leave you with this. Whose option is it? And which one are you going to choose? That's up to you. Okay? Be happy to take any questions.
Thank you very much.